Welcome to our educational video series where we explore important health topics. Today, we will discuss Krabbe disease, a rare and devastating genetic disorder that affects the nervous system. Krabbe disease, also known as globoid cell leukodystrophy, is named after the researcher who first described it, Dr. Hans Krabbe, in 1916. This disease is part of a group of disorders called leukodystrophies, which result from the improper formation and maintenance of myelin, the protective covering of nerve fibers. Krabbe disease is caused by a deficiency of an enzyme called galactocerebrosidase, or GALC. This enzyme is crucial for the breakdown of certain lipids in the body. When GALC is deficient, it leads to the accumulation of toxic substances, which ultimately damages the myelin sheath, resulting in severe neurological impairment. The disease is inherited in an autosomal recessive manner, meaning that a child must inherit 2 copies of the defective gene, one from each parent, to develop the disease. Parents are often carriers, showing no symptoms themselves. The onset of Krabbe disease typically occurs in infancy, usually between 3 to 6 months of age. However, later onset forms can appear in childhood or even adulthood. Infants with the early onset form of the disease often exhibit symptoms like irritability, muscle stiffness, and a regression in motor skills. As the disease progresses, they may develop features such as seizures, delayed development, loss of vision and hearing, as well as difficulty swallowing. One characteristic feature of Krabbe disease is the presence of globoid cells, which are abnormal cells that accumulate in the brain due to the lipid accumulation. This accumulation leads to inflammation and demyelination, progressively worsening symptoms. As the disease advances, affected children may become less responsive, lose the ability to move, and require intensive medical care. Diagnosis of Krabbe disease is often challenging due to its rarity and the broad range of symptoms it may present. Healthcare providers will typically start with a thorough clinical examination and family history. Various tests can confirm the diagnosis, including enzyme assays to measure GALC activity in the blood and genetic testing to identify mutations in the GALC gene. Currently, there is no cure for Krabbe disease, and the focus of treatment is on managing symptoms and improving the quality of life. Supportive care can involve physical therapy, occupational therapy, and nutritional support. In some cases, hematopoietic stem cell transplantation, commonly known as a bone marrow transplant, has been used with varying degrees of success. Early intervention is critical for improving outcomes, making newborn screening vital. Some regions have implemented newborn screening programs to identify infants with Krabbe disease early to enable potential treatment options before symptoms develop. Research into potential therapies is ongoing. Gene therapy, enzyme replacement therapy, and other advanced interventions are being investigated for their efficacy in treating Krabbe disease. Although the outlook for individuals diagnosed with Krabbe disease remains bleak, advancements in research and technology bring hope for future treatments. In conclusion, Krabbe disease is a serious genetic disorder that presents significant challenges for affected children and their families. Early diagnosis and intervention are essential to help manage this condition. By raising awareness and supporting research, we can hope for improved outcomes and better care options for those affected by Krabbe disease. If you found this information helpful, please like, share, and subscribe to our channel for more educational videos on medical topics. Thank you for watching, and take care of your health.